up various symptoms. Maybe they get various alerts to tell them that this is, a good thing or a bad thing, etc. And local people are trained to look after local people. So we don't have expensive universities, although I'm, of course, employed by university, so don't tell anybody I said this, who are training a very small cohort of people who can never, given the predicted increase in rates of growth, can never look after the amount of people that need looking after. So in 10 years' time, I would love if we could have an AI which was maybe funded sort of in a Pan-African sense, that everybody can access to help with their own healthcare, so that we can still pick up the pieces downstream when patients end up or people end up getting worse and deteriorating. We can still look after them, but we can maybe do more work upstream so people don't end up having to come and see us in the first place.
Thank you. Maybe Ms. Rosanne, we conclude with your response.
Thank you so much. And that was really a beautiful statement. So I think one thing I would love to see in the future is to have maybe like an AI for health workforce planning. Like it's almost like what he said, but mostly to predict skill gaps and work so that we can start training the next health care workforce across Africa, like in real time, because I feel like it keeps on changing and there's someone spending 7 years at school, maybe won't even be a doctor at the end of the day. So how can we predict the skill gaps and train for the skill gaps? Yeah, thank you.
Thank you. Thank you to both of you for insightful discussions and for sharing your viewpoints and experience in this important area. Back to you, Dr. Edward.
Thank you very much, Professor Damise. Can you hear me? Thank you very much for moderating a very interesting conversation with Dr. Moneypenny and Ms. Roxanne. So thank you so much. We'll let Professor Angela, perhaps if you want to finish your last few minutes. Professor Angela, are you on? Jamie, is Professor Angela on? Hello? Okay. Okay.
Yes, she
Professor
is.
Angela? Okay.
Okay. I hope you can hear me.
Yes, we can. So please, your last few minutes. Okay, thank you.
Yes. So I want to thank you once again. I'm so sorry about the technical issues. But one area about AI that I want to really throw more light or just discuss is AI and plagiarism, especially as in research. There is growing concern in academia today, the misuse of AI tools for academic writing and research. AI can support our data analysis and literature review and all that. But then there's a lot of, risk of unintentional plagiarism, fabrication of our data, and there's lots of originality. So we must emphasize the medical research and all that. Most of the time, we have to just try as much as possible to verify generated information and maintain the academic honesty. So that will strengthen our researches. Then the ethical issues, especially ethical issues in patient care and safety. There are a lot of things that we know that AI is doing now, especially something like robotic surgeries and all that. So when things go wrong, there is probably a problem with diagnosis and all that. Who really takes the responsibility when the AI system errs? How do we even protect patients' data and confidentiality? We should think about all that when we are, as medical educators, we have a duty to teach not just the science, but also ethics, very important in our medical training and patient care and safety. So we just have to strike a balance between technology and humanity. Sometimes you can see that, because of AI and all that, empathy is completely lost. And we as teachers and trainers in health, we must make sure that we have that moral responsibility to make sure that our students, our trainees are not solely just dependent on the AI. They should not replace humanity. They should not replace empathy and all our intuition and the moral responsibility. So I want to say that in conclusion, that AI can help us to deliver safer and of course smarter and more ethical healthcare education and practice, no doubt. But then let us have a balance. There must be that balance, balancing innovation and integrity. And we have to know that we have to approach this journey not just with fear, but with a lot of wisdom in making sure that we use AI tools very well. So I want to commend the organizers, especially my sister, for this very timely initiative. And I want to thank all the facilitators, the faculties, and all the speakers and the participants for this very inspiring session. Thank you so much.
Okay, thank you very much, Professor, for Angela. Like I said, you brought an issue about technology, which is a big issue. And thanks very much for your comments. Some have been addressed and some will be addressed in the future. We'll be talking about next steps, but definitely we'll have a session looking at some of research issues, or some folks looking at research issues and some of the issues you've raised. Because of time, and we're also very fortunate to have one of the policymakers extremely interested in this area on the call for the almost final remarks. And my colleague, Dr. Francis Obise, who's a principal consultant at ANADAC, will introduce the next speaker. Dr. Francis, over to you.
Thank you, Dr. Igbe. And as we've been speaking since, I like the last comment with the panel that spoke about policy. And now I think it's better for us to hear what the policymakers are doing in this respect. And on this call, we have with us Honorable Atoba Olushola, who is the current chairman, House Committee on Information, National Orientation, Ethics and Value in Nigeria. As we know, AI needs to be, we need for AI orientation now. So I will call on him to just answer this question for us. What key actions do government and institutions need to take today to prepare for an AI-driven future in healthcare education, which is, just give us maybe a small discussion, no more than 5 minutes. Honorable Olushola, please, over to you. Thank you, sir. Honorable Fatoba, I know you said you want to go and see the minister. I hope you are still there.
Okay. Jamie, is he on?
I think he's
he
on.
hasn't dropped off.
No, I think he's on. He hasn't dropped off.
Okay.
I don't know if he's muted. He's on.
Okay. But I think one of the things we reminded have been is the technology challenges, which the technology. Okay. Honorable Fatoba, over to you.
Yeah,
good afternoon, sir. Yeah.
Thank you for inviting me to this very important meeting. Hello?
Hello, we can hear you.
We can hear you.
Yeah.
We can hear you. Okay.
Sorry, I was having a little network issue. I think I'm to discuss on the key action the government and institution needs to take to prepare for the future of AI in tertiary education, in tertiary healthcare education in Africa. Today, we stand at the threshold of transformative era, one where artificial intelligence is not just a technological advancement, but a catalyst for reimagining how we educate, how we heal, and how we serve our communities. In Africa, where the demand for skilled health professionals far outpaces supply, and where access to quality education remains uneven, AI offers us a rare opportunity to leapfrog traditional barriers and build a future that is smarter, more inclusive, and deeply responsive to our continent's unique needs.